Hi, let's talk about the ureters and the urinary bladder. So let's start our story at the kidney. As you recall, minor calyces surround renal papillae. That's where urine is unambiguously formed from filtrate at the end. And then minor calyces coalesce into major calyces, which we can see here. And the major calyces coalesce into the renal pelvis, which is contiguous with the ureter. So as there are left and right kidneys, there will be left and right ureters. Ureters are tripartite. So there are the abdominal parts of the ureters, the pelvic parts of the ureters, and then the intramural parts of the ureters, which are embedded in the wall of the fundus or base of the urinary bladder. Now that transition from abdominal to pelvic part of the ureter generally occurs in the vicinity of the branching of the external and internal iliac arteries. Now, as we look at a sagittal view, we can see in a female pelvis the ureter descending into the pelvis, so transitioning from the abdominal to the pelvic part with the internal iliac and the external iliac there. And as it continues on coming down, it's going to dive below the uterus there. And we can see that the uterine artery is going to cross over the ureter at the level of the internal os of the uterus. So that is the water under the bridge mnemonic that you've likely heard before. So here is the urinary bladder that we can see with a superior surface, an apex, a base, and a neck, which is then funneling into the internal urethral meatus. And so those ureters are going to enter in through the wall of the base or the fundus of the bladder. So that would be where the intramural part of a ureter is located. So here we have sagittal sections of, typical male and female pelvis. Just point out some of the features there. A little more clean on the pelvis here to the left. So here's the superior surface of the urinary bladder. So that's superior. And then the fundus, also known as the base of the bladder, is posterior. And then we have the apex here. And then the neck of the bladder, where we can find the internal urethral meatus. That internal urethral meatus is surrounded by the internal urinary sphincter. On the male pelvis, it's a little less distinct. So here we can see the urinary bladder, and that urinary bladder is sitting atop a prostate gland. And so here is the base of the bladder. Here's the superior surface. It's a little distended, and then there would be the apex. So it's a little out of position for where it normally would be, hugging that pubic symphysis there. We can also see a seminal vesicle, the posterior. That seminal vesicle is going to secrete and join with the ductus or vas deferens into an ejaculatory duct that would meet within the prostatic part of the male ureter, male urethra. Here we have a more of a superior anterior view of the urinary bladder with the superior portion removed. So we're looking at, there's the fundus or the base of the bladder there. Here are the ureteric openings. There's the ureteric crest, and there's the internal urethral hiatus. So if we connect the dots here, we can see an area known as the trigon of the bladder. Thank you very much for your time.